Hello everyone!
Today, let's take a look at one of the most reported mental health disorders, which is Major Depressive Disorder, MDD. Before we start, this is the outline of what we will be discussing about. Do you know what is MDD? Major Depressive Disorder, or also known as clinical depression, which is characterized with prolonged feeling of sadness, difficulty in concentrating, functional impairment, and suicidal ideation for more than 2 weeks. Now, let's see how often is MDD. The lifetime prevalence is about 5 to 17%. Women are 20% more prevalent to get MDD than men. In Malaysia, elderly is roughly around 20 to 50% to get MDD. Rural areas are more prevalent to get MDD than urban areas. Moving on to the factors that will cause MDD. First, MDD can be due to genetic and family history. Next is gender, where women are 2 times to have depression than men. Next cause is patient with low levels of neurotransmitters. Patient that have mental disorders, sleep disorders, and chronic pain and stress. Patients experiencing physical, emotional, and sexual abuse are also the cause of MDD. Substance abuse and medications such as sedative and sleeping pills can be the cause of MDD. Now, let's take a look at the classification of MDD. MDD can be classified into 3, which are mild, moderate, and severe. Mild category is when patients have more than 5 symptoms and minor impairment in social or occupational function. Moderate MDD is similar to mild, but the impairment is in the range of mild and severe. Meanwhile, severe is when patients present with most of the symptoms and may present with or without psychotic symptoms such as hallucination and delusion. So, what are the signs and symptoms of MDD? Common signs and symptoms of MDD are when patients are having a depressed mood, loss of interest, and reduced energy. Other symptoms including significant weight loss even without dieting, difficulty of falling asleep, retardation, feelings of worthlessness, and recurrent thoughts of death can also be seen. Signs and symptoms must be present at least 5 or more for a period of 2 weeks, and it will happen most of the time and every day. How do doctors diagnose patients who have MDD? They usually diagnose patients by doing detailed history taking, mental state examination, and physical examination and investigation. Detailed history taking such as presenting symptoms, past medical history, family history, previous hospitalization, substance abuse, mode of onset, suicide attempts, and many more. For mental state examination, doctors look for risk of harm of patient to self or others, evaluation of depressive symptom severity, and see if the patient are present with psychotic symptoms. And lastly, the last diagnosis is by physical examination and investigation are to rule out any medical or surgical causes of MDD such as hormone imbalance and effect of antibiotics. Next, laboratory tests may be required if the presentation of symptoms is atypical, meaning unusual, where in some cases such as the first major depressive episode after the age of 40, elderly patient, and patient not responding to standard treatment, lab tests may be necessary. After all, MDD is not curable. Therefore, treatments are usually given to reduce symptoms and improve quality of life. Treatments such as psychosocial intervention, psychotherapy, pharmacotherapy, and ECT are given according to the severity of the symptoms. For mild to moderate, psychosocial intervention is the first-line option of treatment combined with psychotherapy, with pharmacotherapy being optional. For moderate to severe MDD, pharmacotherapy will be the first line followed by the others. If someone presents with psychotic features, this is the flow of the treatment. How psychosocial intervention can help to treat MDD patient. This intervention is applicable to a person who is not interacting well with society and brings the person back into a healthy state. Let's see some of the psychosocial intervention. The first one is psychoeducation, which delivers information related to MDD, such as describing symptoms and drug side effect. Counseling such as talk therapy between patient and therapist. Peer intervention, which involve peer support workers, person that has recovered from MDD sharing their experiences. Doing exercise at least 3 times per week for 45 to 60 minutes. Relaxation such as yoga and deep breathing. And lastly, psycho-spiritual intervention, which is spiritual meditation. Next is psychotherapy, which can help eliminate or control troubling symptoms so a person can function better and can increase well-being and healing. It includes connective behavioral therapy, which involves therapists together with the patient figuring out how to change unrealistic thoughts and behavior. Behavioral therapy such as social skills training and relaxation therapy. Interpersonal therapy assists patients in managing interpersonal distress, and problem-solving therapy, which helps to identify personal problems, develop and implement most adaptive action plan to solve the problem. The next treatment option is Electroconvulsive therapy, ECT. ECT is for patients that have not responded to other treatments. In other words, the last treatment option for MDD. It works by passing through small electric currents to the brain, triggering a brief seizure which can reverse the symptoms of MDD.
Pharmacotherapy is treatment involving antidepressant drug. There are 6 classes of antidepressants. Selective serotonin reuptake inhibitors, SSRI, are the first-line treatment for MDD. So, how does it work? SSRI blocks the reabsorption of serotonin in the brain, thus increase serotonin level. This is because if you're struggling with depression, the areas of your brain that regulate mood and send messages using serotonin might not function properly. Thus, SSRI can help make more serotonin available. SSRI may cause nausea, insomnia, nervousness, serotonin syndrome, and sexual dysfunction. Next is serotonin norepinephrine reuptake inhibitors. Let's see how it works. It works by blocking the reabsorption of serotonin and noradrenaline in the brain, thus increase the level of both chemicals. The side effects of SNRI are pretty much similar to SSRI. DNRI, which is norepinephrine dopamine reuptake inhibitors, such as bupropion. What is the mechanism of action of this class of drugs? It works by blocking the reabsorptions of dopamine and noradrenaline, thus causing both chemicals to be more available. DNRI can trigger seizures in patients. Therefore, monitoring electroencephalograms, which is electrical activity of the brain, is necessary. The next one is tricyclic antidepressants. The mechanism of actions involving blocking the reabsorptions of noradrenaline and serotonin in the presynaptic nerve. It also affects other receptors such as muscarinic, cholinergic, and histamine receptor, which lead to several side effects. It causes dry mouth, blurred vision, constipation, and cardiovascular effects. Additional note on this, due to its strong side effect, TCA is not the first-line or second-line treatment. TCA needs to be cautiously used in patients with cardiac disease and seizure disorder. Next is monoamine oxidase inhibitors. The mechanism of actions of this class of drug is inhibiting the activity of MAO enzyme, thus prevent the breakdown of neurotransmitter and increase its availability. It causes postural hypotension, dry mouth, and sedation. MAOI is not recommended as first-line treatment due to poor tolerability profile, increased side effects, and serious drug interactions. Patients should avoid taking food high in tyramine such as cheese and banana, as it can cause a sharp increase in blood pressure that can lead to stroke. The last class of antidepressant drug is NASSA, which is noradrenergic and specific serotonergic antidepressants. How does it work? It blocks alpha-2 adrenergic receptor. This leads to an increase in serotonin and noradrenaline level. It also has minimal blocking effects on serotonin and histamine receptor. The most common side effect is it may cause significant weight gain, thus it is important to monitor the body weight of the patients. With that, that's all from us. We hope that you learned something new about MDD. There's a quote saying, "There is a hope even when your brain tells you there is not." Thank you! Don't forget to like, subscribe, and hit the notification bell for more updates. Thank you for watching.